Mrs. Doubtfire?
Hi.
Hi, I'm Colleen. I'm the SLP. It's great to meet you.
Nice to meet you too.
So we're gonna head right this way.
Okay.
You can have a seat here.
Great.
So how are you?
I'm okay, I guess.
Good. So I know we talked a little bit about Natalie, but do you want to tell me a little bit more about how things are going at home?
Yeah, so she's just kind of going up to strangers a lot, and she's a little over friendly with them, and I can't seem to really get a grip on her. She kind of runs away from me, and I don't know where she is, and then I panic, and then I find her, and she's talking somebody's ear off, and
Wow, so it sounds like you're really concerned about Natalie's behaviors. Do you have anything specific that you could give me an example of?
Actually, yeah, just yesterday, she went to we had a doctor's appointment, and in the waiting room, it was just a mess.
Oh, really? Okay, tell me more about that.
So she went in, and I turned my back for just a second to get
Natalie, I'm gonna go get a magazine. Stay right here. Okay, don't move. Oh my gosh, I love your work so much. I love the color. It's desperately pretty. Natalie, no. Natalie, absolutely not. We do not do that. Not appropriate. Go sit down. I am so sorry about that, sir. She just really loves watches. I'm sorry she has a disability, and I try to tell her no, but she's a little high strung. I'm really sorry.
It's okay.
I just really want to apologize. Are you sure it's okay?
Yeah.
She didn't mess up not your watch or anything? Natalie, absolutely not. That is not how we behave. Not okay. Look at me when I'm talking to you. Don't look away. Absolutely not. No. Again, I'm really sorry. I apologize.
It's very friendly, and it's kind of I'm concerned about her safety now.
Right, and with her being 4 and getting ready to go to school, I'm sure you have a lot on your mind. But I know you mentioned that Natalie has Williams syndrome.
Yeah.
So I'm sure you're really familiar with her diagnosis, but just to go over a few quick things, it is really typical that children with Williams syndrome are really friendly and really talkative, as I'm sure you're seeing.
I noticed
Natalie.
that. Yeah.
So they actually like to call that cocktail speech. So they like to go up and have, for lack of better words, that surface conversation. So they talk about what's right in front of them, but they might not be that great at maintaining conversations or knowing when it's appropriate to touch or not touch, and
Yeah,
how
she does
far.
all of that. Yeah.
Right. So that is very typical, everything you're experiencing. But I think what might help is getting to know a little bit more about your feelings and maybe rating them to see how intense they are.
Okay.
So it does sound like you're feeling a lot of different emotions, right?
Yeah, definitely. Very emotional.
Right.
Love my daughter, but she's a trial sometimes.
I'm sure, as all 4-year-olds are.
Mm.
So let's rate some of those feelings, maybe on a scale from 1 to 10.
Okay.
So 10 being with the highest intensity and 1 being the lowest. So let me know about, it sounds like you're really frustrated.
Yes.
So,
Yeah, I'm really frustrated because she gets away from me, and then she doesn't listen when I call her back.
right, so how would you rate that frustration?
Probably like an 8.
Oh wow, okay, so high up there.
Yeah, it's very frustrating.
Great, so what other emotions do you think you're feeling when Natalie is getting away from you or you're nervous about what might happen?
Right. I'm definitely stressed, and because I don't know where she is if I turn my back for a second, and I get anxious because, like I mentioned before, I don't want her just going up to random strangers. That's not really good for her. It's not safe.
Right, those feelings are very valid, but how would you rate those feelings, would you say?
So for stressed, I guess I'd say like maybe a 6 or a 7.
Okay.
And then anxious, probably like a 6. Yeah.
Okay.
It's increasing the older that she gets and the more she can like walk around and stuff like that.
Right, and I know we talked earlier too that her language has really taken off. So I know typically children with Williams syndrome might be delayed in their language, but I'm sure now that she's more talkative, you're a little bit more worried about that as well.
Yeah.
So why do you think that you feel so stressed and anxious now, compared to before?
I think because she can walk around more, and I'm just worried somebody's going to take her from me. Like, God forbid what happens if somebody decides to take her because she's just this cute little friendly girl that's going up and giving somebody a compliment.
Right.
And then, she's going to start school in a couple months. And I'm worried that all the kids are going to think that, like, they're going to think she's weird and they're not going to want to talk to her or play with her because she kind of just goes off on her own little tangents and she grabs people when they don't probably want to be grabbed. And, the kids aren't going to respond to that. The kids aren't going to know the difference. They're just going to see the weird girl that grabs people and talks a lot. And I don't want her to be that girl because she's really, really sweet.
Right. I see that in her too. I mean, she's a great kid. But I think what you're saying, we can work together. I'm thinking of some strategies to go into this head first.
That'd be great.
So tell me a little bit more about how you respond when Natalie runs off or runs up to a stranger.
Oh boy. Okay. The first thing I usually do is run up to her and I yell and I panic and I freak out at her and I pull her off the stranger right away. I apologize to the stranger over and over again and then I turn around and I usually talk to her a lot and I kind of lecture her about why she shouldn't go up to strangers. And then she's not happy and I'm not happy because I just yelled at her. So it's a big mess.
Right. So, I mean, it sounds like those are all normal responses to being anxious or stressed out or worried about your daughter. I actually had an idea of what you two could do together that might benefit the both of you. So, I think in those moments when Natalie is running up to a stranger and touching them, I think if you are able to calmly approach the situation and then talk to Natalie with the stranger there. So maybe what you could do is explain to the stranger that you and Natalie are working on appropriate stranger interactions. And a lot of times I'm sure you see this, strangers say, "Oh my gosh, she's so cute, don't worry about it."
Yeah.
Which then you, I'm sure, find it hard to
It's
get
hard to
back
discipline
into,
her and stuff
right,
like that
when
when
people are saying,
that's cute.
right. So I think in that moment you explain to the adult, "Oh, I'm really glad that this didn't bother you, but if you wouldn't mind and if you had a minute, I'd like to use this as a teaching moment. We're really working on Natalie learning appropriate boundaries." So I think in this instance you could give her a few cues. Okay, so I've written out a list here of some things that you and Natalie can do together. So I'm thinking if you teach her these things at home, it'll really help when you're generalizing these skills out in public.
Okay.
So, for starters, I know this is one of your concerns, and she should talk to you before she's leaving. So,
Yes.
you can open that communication, and then also encouraging her to walk up to whoever she wants to approach rather than run and kind of tackle that impulsivity that she's having when she's approaching people.
Mm-hmm.
And then also how important it is to introduce herself to the stranger and to ask permission before she touches them because, like you said, we're not sure how people might react and we just want to make sure that she's staying safe and also interacting appropriately.
Okay, so I go over all of these with her. I mean, they sound really good. It sounds like something that she could hopefully get in the habit of doing in this way. I won't be so scared every time she wants to go and talk to a stranger because I know she'll at least know how to do it safely and appropriately.
Right, and another benefit for this is it'll allow you guys to have that extra bond with one another. So you won't feel quite as overwhelmed in these situations because you'll have the skills to then pass on to Natalie.
Dear Colleen, we can't thank you enough for guiding us on this journey. I know we're scheduled to meet again in just 2 weeks, but I was so excited I just wanted to pass along this story. We've been implementing your techniques and it's been great. It's been a little challenging, but I'm getting more comfortable using inappropriate social interactions as teaching moments and explaining that to the stranger. Natalie is doing really well and doesn't need much cueing anymore. We've been having a lot of fun together and can't wait to keep moving forward. Just last week we were at the doctor's and I wanted to tell you how it went.
Hey, Natalie, play with your puzzle. I'm going to be right back. I'm going to talk to the doctor, okay?
Your raft is so cute. It's so tiny. How did it get that small?
Natalie.
Would it fit in my dress?
Natalie,
I don't
we
know.
don't do this, remember? Right? How do you say hi to a stranger?
Hi, I'm Natalie.
Hi, Natalie. I'm Lindsay.
Good. She's really into watches. Do you mind if I kind of use this as a teaching moment for her? We're working on kind of like appropriate social skills and stuff like that.
Oh, that's
Are you okay? All right, so what's something you could say if you like this nice lady's watch?
I like your watch. Thank you.
Good, that was very nice. So you tell her you like your watch and then what do you do?
Can I touch it? Yeah, you can touch it.
Okay, just be very gentle with it because it's not yours, remember. Wonderful. All right, that's enough. So then how do you say you appreciate her letting you touch your watch?
Thank you. You're welcome.
Good, and then you say bye.
Bye. Bye, Natalie.
Good, thank you. Thank you, I appreciate it.